The gluteus medius muscle is a powerful hip extensor and abductor. All of its fibers are responsible for abduction of the hip. The anterior fibers are responsible for flexion and medial rotation of the hip, and the posterior fibers extend and laterally rotate the hip. The gluteus medius originates at the gluteal surface of the ilium between the posterior and anterior gluteal lines and inserts at the lateral aspect of the greater trochanter. It is innervated by the superior gluteal nerve. The gluteus medius muscle helps to keep the pelvis level during ambulation. If this muscle becomes weak, it can clinically present as a positive Trendelenburg sign, meaning when the individual stands on one leg, the pelvis will drop on the unsupported side. This indicates weakness in the gluteus medius muscle, contralateral to the side of the pelvic drop, which would be the stance leg. Functional limitations of a weakened gluteus medius muscle would be the result of gait abnormalities, specifically a gluteus medius gait. This means that during the stance phase of ambulation, the patient will laterally flex their trunk over the affected side or the side of the weak muscle. This is an attempt to pull the center of gravity over the hip and reduce the muscle force required for stabilization of the trunk and pelvis, therefore reducing pelvic drop. This unnecessary lateral flexion could result in wasted energy, therefore fatigue and the reduced ability to complete activities of daily living. To test for weakness of the gluteus medius muscle, a manual muscle test can be performed. Manual muscle testing is a procedure used to evaluate the function and strength of a particular muscle or muscle group. The muscle or muscle group is graded based upon its ability to move in relation to gravity and resistance. The recommended position for manual muscle testing of the gluteus medius is sideline. The patient should be encouraged to lay their head flat on the table rather than prop it up on their arm. This will keep proper alignment of the spine and pelvis and will limit the patient's ability to compensate during the test with lateral flexion. The lower extremity being tested should be superior and slightly extended, with the inferior extremity being flexed to ensure stability. The patient's pelvis will also be slightly rotated forward. The patient will first be asked to abduct and slightly extend the leg being tested. If the patient is able to move through the full arc of motion, it can be determined that the patient's strength is at least 3 out of 5 because they are able to move against gravity. Next, the clinician will stand behind the patient and place their hands on the ankle and proximal to the greater trochanter. This will ensure the greatest moment arm is being used in order to generate the most amount of torque and provide accurate results regarding the patient's strength. The clinician will then add resistance to the superior leg straight downward in the direction of adduction while the patient abducts against the force. The patient must not flex or rotate the hip in an attempt to compensate. So as you can see, the patient here is able to move their leg through a full range of motion against gravity. This means the strength in their gluteus medius is at least a 3 out of 5. Here, when the SPTA applies maximum force to the patient's lower extremity, she is able to resist. This means the patient has 5 out of 5 strength. If a patient does have weakness of the gluteus medius muscle, they will be unable to provide adequate resistance to the force provided by the clinician.